If you don't take control of your healthcare, how can you get the best outcome that you're trying to get? Because other people may have other incentives.
What's going on, everybody, and welcome back to the Next Big Thing podcast, where today we are joined by Chad Erickson, one of the co-founders of GoodDoctorBadDoctor.com. So, Chad, thank you very much for joining us, and thank you for your time.
My pleasure. My pleasure. So, you guys want to know how we got here and why we're doing this? Is that what the big question?
Yes.
Okay.
Absolutely. Yes. Tell us about Good Doctor, Bad Doctor.
So here's a problem, and I can say this because I've been in healthcare now for 20 years, Barry about 19 and a half. So we've been doing this for a while. And the problem is it's that moment that you need a doctor, your child needs a doctor, or a loved one needs a doctor, or you've got a friend that needs a new doctor, and everybody refuses to listen to you. So our approach is that confidence in the information makes you feel good about your decision. And a lot of times you can't tell a loved one, but you can show them. So with our solution, in 5 clicks or less, you've done your due diligence and you can move forward empowered with transparency. Then you can text or show your loved one so that they can be empowered too. This is a better answer because you feel good about your decision. You're more likely to follow medical advice. And really, that's one of the things that's keeping people from doing the things that their doctor has asked them to do. And if you don't do what your doctor's asked you to do, you're not going to have a good outcome. And let's face it, that's why we go to the doctor anyway. Nobody goes to the doctor and says, hey, yeah, I want to go see a neurosurgeon. Yeah. No, what they do is they go and they say, I'm hurting so bad that I've got to go somewhere for help and I need a better outcome. And that's what we're trying to do, is we're trying to not only help people make better decisions, but for them to feel more confident about those decisions.
Now, Chad, what's the story behind starting GoodDoctorBadDoctor.com?
Well, so this kind of starts. So I was the executive of a neurosurgery clinic. And so I've got 7 of the best neurosurgeons in Texas that I'm working with. And I can say that definitively because I've seen their comparable outcomes with the rest of the people out there. And so I'm there and I go to call my mom and say, hey, can you watch the kids? And she goes, I can't. I'm getting a myelogram. I'm like, Mom, which is, for those of you that don't know, it's a very invasive study of the spine where they remove some of the cerebral spinal fluid. It's a pretty significant study. And I said, Mom, I work for some of the best neurosurgeons in the country. I didn't want to bother you. Okay. Well, I said, at least let me get the information and let some of my guys review the data. Well, I got the review from her and got the report and everything, brought it to one of my guys, and he looked at it and he said, she's 60. There's going to be some compression going on there, but there's nothing out of the usual. This actually looks well within tolerances. Well, it turns out when I call her back, she's scheduled for a 2-level fusion from this guy that she went to go see. Yeah. And I had a hard time convincing my mom. I had to get my doctor on the phone to tell her, no, do not do this. And if I'm in the industry, and I've got great friends across the entire state of Texas and actually across the whole nation that are all in administration. I've been a member of the Medical Group Management Association for a long time. If I can't convince my mom to make a good decision, what chance does the average person have?
So why does it seem like we hear so many news articles about misdiagnosis, more than we want in the healthcare industry? Is that a problem with like the quality of what they're doing, the complexity of the issues, or is it more of a lack of accountability?
It really depends on the institution, but I would say actually one of the highest contributors to this is the burdens that we've put on the physicians as far as documentation. Right now, I can tell you with the advent of EMRs, and they have these programs that Meaningful Use and PQRS and all these other programs that are supposed to help with our population. But what it does is it means the doctor spending less time with the patient and more time doing this kind of CYA and billing dictation that they're having to put in there. And so we've gone from, when I first started working in medicine, most doctors were spending 60% of their time working with patients, 40% of the time doing documentation. Now it's almost flip-flop of that. And so you've got these guys, they'll meet with you for 5 minutes. They meet with you for 5 minutes, but they're doing 7 minutes worth of chart documentation just so that they can bill, excuse me, just so that they can bill and so that they can actually meet all of the legal standards that they need to. That's my opinion, by the way.
So the healthcare industry really, in a sense, is a big network, and Good Doctor Bad Doctor is trying to bring that network, make it more accessible to people. And I think everyone can relate to finding a doctor, especially for specialized care, can be very difficult. So what is Good Doctor Bad Doctor doing specifically to help broaden doctor review sites in general, something that's not really there right now?
Well, to start out with, the main thing that we're doing is we're making it really easy for you to transparently look at any kind of board actions that might be associated to your physician. Now, let me clarify this. There is a very small subset of the population of physicians that have a board action against them, and the vast majority of doctors are outstanding. But if your pediatrician was picked up on solicitation of a minor, you'd probably want to know that. I'm just going out on a limb there. And the
100%.
thing is a lot of the things that are out there are really subjective. You have somebody come in and they say, hey, I don't like the carpet. This guy's an idiot. Or actually, funny enough, if you're going to a pain management doctor, you really want to go to one that has about 3 stars, because that means all the people that are seeking drugs that are angry at him wrote him bad reviews. And so he's actually a doctor that's conscientious and thoughtful doing that. So I love, and it's one of the quotes from the founders of the US World and News Report when they were developing their strategy for physicians. There is no perfect way to evaluate medicine, but there are better ways. And if I can help you be able to look and say, hey, not only is my doctor doesn't have any board actions, but actually he was a stellar resident and has been practicing for all these years. If you've got a doctor that's been practicing for 30 years and has never had a major board incident or review, that's a pretty good doctor. That's pretty strong. So, and that's another problem is when you get to a specialist, you don't know this doctor. This isn't something that you've developed a relationship over time. And unfortunately for a lot of these specialists, you're going to interact with them for probably 20 to 30 minutes total through the process.
So going off of that, what's the business model like? How are you looking to start integrating these procedures and start integrating the site? Who are you going to first, core customers,
Absolutely.
and how are you starting to grow that?
So here's the dirty little secret of medicine. I'm going to tell you guys, there are places that have spent millions of dollars figuring this out, and I'm just going to give it to y'all for free. All right, here.
Let's go.
Women between 27 and 57 who are married drive the majority of healthcare in the United States. And so those moms that are between 27 and 57, a lot of times they're managing the care for their kids. They're managing the care for themselves. They're managing the care for their husband. And they're also now, and this is something that's kind of recent, they're managing the care a lot of times for their parents and even their in-laws. And so that's a lot of people to keep track of and make sure that everybody's going to the right place. So that's my target market right there. And so what we're doing is to launch this, really, we're reaching out to those individuals and saying, hey, we want you to have the confidence in the physicians that your family is going to see. And so the big thing is there's a freemium. They can come in there and they can check. They can check a few times a year. It's all of this data. If you really wanted to dig and you knew where it was, it's freely available. It's just a pain in the butt to find. And so we just make it, we're selling a service where we make it easy. But the big thing is for these women who are managing all this healthcare, what we're doing is we're creating a product called DocWatch, where you can have up to 10 physicians that are listed in there. It's a yearly subscription. And if there's an issue that comes up, you're getting a text message or an email. And so it's you getting proactive in the care for your family and friends.
So we talked just before we started the interview that Good Doctor, Bad Doctor is a subset of a greater network of healthcare review that you guys are building. I think you said 47 different URLs. Can you talk about that and how it's all connected?
Well, here's the thing is healthcare is really complicated. And if we can help simplify that for, like I said, for the average family that's out there. For example, one of the big ones that I'm really excited and can't wait to get to is good hospice, bad hospice. And the reason why is because nobody plans to have hospice care. Like just recently, we had to do this for my grandmother, and it was, is kind of a 1 week she's fine, and the next week, wow, we got to figure out hospice care. And some of them are good, some of them not so much. And there's a lot of spectrum in there. There's a lot of different programs for how that is. And so just being able to help people to make these major medical decisions with as much transparency to the public data as you can in one place, that's really our mission.
Is there going to be a review or a rating system in place for Good Doctor, Bad Doctor?
We will eventually. We thought the most important thing, and really this is, there's a lot of places that you can click your stars and say, hey, this is how good it is. But starting with our key differentiator is starting with this transparency to the public data that's out there. That's really our core differentiator, is putting that out there and making it so that that part is easy. Yeah, we'll be building all the rest of that, and then we'll be integrating the sites together. So, you can, like I said, you can click onto a hospital and see all the doctors that have privileges there, and then be able to click through those. Maybe you love that facility, or you don't. Maybe you love that doctor and you don't know which facility you should go to. I can tell you there is a symphony of things that have to happen for healthcare to be good.
So you've been in healthcare for, I believe, your entire career. So, or at least most of your career. What is one thing that you have seen change since the beginning of your career that you think has been the most significant, had the most significant impact on the industry?
The Affordable Care Act, there's an aspect of that was significant in that we went from Congress having to pass changes to different aspects of Medicare, which Medicare is the biggest payer in the entire nation. It really does set the tone. It used to be that we would have Medicare for 2-year periods. Like if there was a Medicare Modernization Act of 2003, it wouldn't go into effect until 2005. So we had a lot of time to adjust. Healthcare is one of the weirdest financial industries out there. I mean, where else would you do something and you don't know if you're going to get paid like in 3 weeks or in 90 days or maybe in 180 days? I mean, I was just at a meeting with one of the medical group management associations this week where they were talking about, hey, we've got claims that are outstanding for almost 2 years now, and that we're still fighting. Now, our change management cycle is about 6 weeks.
Do you think the claims structure and the uncertainty of not knowing when you're going to get paid kind of adds to the pressure of this overarching theme of, the pressure building up on the physicians or on the doctors, and they're good, but there's so much pressure in trying to keep up with the rest of the competition?
Yeah.
Is it, building up on top of that?
And here's the thing is, what I'm talking about has also caused the second biggest change. When I first started, 3 out of every 10 doctors was employed. The rest were independent. We're just the opposite now. 7 out of every 10 doctors is employed. 3 of them are independent. And a lot of that is because of these financial pressures and the uncertainty that's going on there. It's just so hard to fight.
What impact does that have on patients when it flips from 70% independent to now only 30% independent?
There are, let's just say that there are influences and pressures upon doctors that are employed or part of a group that might not be there in other places. And by the way, just so you know, there's not a right or a wrong here. Some doctors, employment is the best place for them to be. And it allows them just to focus on medicine, and boom, they're rock stars there. Some doctors, if they don't own it and they don't feel some ownership there, they really just, they're kind of mailing it in. They're not, and so there's, again, it's not a right and a wrong. You got to find a doctor, where they're at. But here's the thing is, those systems have significant influence on what the take home of that doctor is. And in particular, and this is a big one, and this is another reason why we're doing what we're doing, those doctors don't always control their referrals. So are you going to the doctor that your primary care physician really wants you to go to, or are you going to the primary care physician that their employer wants you to go to? And, in some cases, it is the doctor that's making that decision. I can tell you there's cases where that's not.
That's incredibly interesting and something I didn't know. And I'm kind of going through my head of my own kind of history and thinking back to all those times. It's that level of transparency that is really nice that you guys are trying to provide.
Well, if you don't take control of your healthcare, if you don't take control of it, how can you get the best outcome that you're trying to get? Because other people may have other incentives.
Right. And on understanding those incentives, are going to lead you to a better decision.
Absolutely.
And I wanted to pivot a little bit and talk more about your entrepreneurial journey.
Okay.
What are the lessons you've learned, maybe some key moments throughout that journey that you've had?
Whatever you think you're going to do at the beginning, just take that with a grain of salt. And, it's one of those things where, and I got this from, there's a really strong entrepreneur here in the North Texas area. His name's Trey Bowles. He was kind of joking about something at a conference earlier this week where he said, your friends will lie to you, your family will lie to you, other people will lie to you, but the market will not lie to you. And it will tell you, yep, that's what we really want.
I love that.
He also said, and this is my favorite quote from him, being an entrepreneur, it sucks until it doesn't.
Fantastically put. Fantastically put. No, whenever we talk to different entrepreneurs, obviously, I'm always taken aback by how mission driven they are. And it seems that you are just as mission driven as them due to your history in the healthcare industry. What would you say your mission is with Good Doctor, Bad Doctor, your personal mission? What drives you to keep going with this?
Yeah, I'll tell you, this has actually been my mission throughout all my time in healthcare is, can I shorten the distance between patients and the care that they need? Because really, you don't want me to be your doctor. That's not what I do. But what I do is I help those doctors work more efficiently and effectively so that those patients can get to them faster, they can see more of them, and they can get higher quality care. I am super, super proud of the physicians that I've worked with over the years. I've worked with some people that just almost like you could see divinity coming in to help make people's lives better. Like this, sorry, this kind of chokes me up, but when you've got, literally, you've got 5 of the smartest people, probably, academically, top 1% of the top 1%, that are all gathered around one case to try and make this person's life better. How can you not support that? And so if we can help people avoid the bad and get to the good faster. I mean, I think both myself and Barry, we feel very strongly about this, and that, if you're not doing right by your fellow man, what are you really doing?
Well, uh, it's awesome hearing that, because the mission is literally trying to save lives. And I don't know if there's a better mission than trying to save a life. And then telling that story about seeing 5 of the brightest people just trying to help this one person, that really shows you just how valuable the human life is and the importance behind it too.
100%. Well, and here's the other side is I've had loved ones going through this right now that, again, a family member that I talked, didn't listen. She went and got a procedure that she shouldn't have gotten from a doctor that she shouldn't have gotten it from at a facility that really wasn't equipped to do what she needed done. And here we are 5 years later, and it has been the last 3 years have been debilitating. And we met up last night to go swimming, and she can't even get into the pool until this gets fixed. And so I know what happens when when that symphony goes wrong. I know. And when it goes right, it's miraculous. It's amazing. And when it goes wrong, it's devastating. And how many of those can we avoid?
I think your guys' mission is so inspirational, because when you're talking about that, even I can think of moments where I can connect that to times where, my father's been in the healthcare industry for his entire career. And he also, like you, is just so passionate about the great doctors that he meets and the great doctors that he knows. And then you talk to a layperson, someone who's not necessarily involved in healthcare and doesn't necessarily know. And all the stories that you hear from them are the bad doctors they've met. And I think what's so important, what you guys are doing, is you are creating a connection between the people that know truly what great care is and the people that have never received great care. And I think that truly, from the conversations that I've had, is the biggest disconnect in the healthcare industry, because healthcare is 100%. A great thing. Healthcare is a great thing. But if you don't have the tools to get that great healthcare, then healthcare can be a really, really damaging thing. And everyone has those stories on either side of the aisle. And it's making sure that those negative stories don't happen as often.
I couldn't agree with you more. And, Brendan, I've worked with physicians that didn't quite get their due, but I've seen their complication rates. I've seen the miracles that they've worked with some of the most complicated patients out there. And this is also a way for them to be able to get through all that marketing fog, and for people to actually see, oh my gosh, this guy's a rock star. Holy cow. Yeah, I need to go see this guy. Because we all know in the industries who the rock stars are. I've got a friend that's a professional. He was a Hall of Famer football player. He knows, like, hey, this is where all my buddies go. This is the guy that has because they're beat up. They're like, it's like if you threw them out a building and they hit every branch on a tree all the way down. That's kind of what they look like. And it's all kind of broke up. And so being able to go to somebody that can handle that kind of acuity, that's important. This isn't a, hey, I just need my knee scope just a little bit. I've got a 25% or something like that. But your average person can't see that. And that's where we're trying to get, is where people have more and more transparency. And this is, as we get more people adopting and using what we're doing, we're going to be going after more information to empower these patients to be able to make better decisions.
So Chad, 5-10 years from now, going off of that, Good Doctor, Bad Doctor becomes a success. Paint us a picture of what that looks like to you, what that looks like to everyone else, how that impacts the healthcare industry.
Do you want my crazy in the head?
Yes,
idea
100%.
For 5 years? Or do you want okay.
Give us both.
All right. Well, I'll give you my realistic view. I want you to be able to see the spectrum of your healthcare and be able to get on and see without doubt that who you're going to is the right fit for you. Because here's another thing: is just because a doctor's really good doesn't mean that they're the right fit for you.
Can you explain about that?
Yeah. Well, I mean, one of the most important things is if you're going to listen to the physician that's talking to you. Because a lot of times, if the patient doesn't feel like they had a connection with that doctor or whoever the caregiver is, they don't listen. They don't take that medical advice. They don't take their medication on time. They don't actually stop and reduce the salt in their diet. Whatever it is, they don't listen. And so finding somebody that you connect with is important. For me, I want somebody who's going to get in, give me the facts, get out, and be done. For some of my other friends and family members, they want somebody who's going to ask them about their family and how was the weekend, and hey, you're looking good for having this, but let's try something else. And that works for them. Fantastic. Ultimately, I want to get to the point where I can say, from a rating standpoint, I want to be able to tell you, hey, not only is this doctor good and has, doesn't have any skeletons in the closet, any of that stuff, and got really high marks, but also they've gotten really high marks from, let's say you're an early 20s female, and they've got really high marks from other early 20s females that they felt listened to and all that. So I'd want to pull that anonymized demographic information to be able to help people for their specific subset of what they're going through. That's where I really want to go. And then I want to incorporate that into physician stuff. Now, where my crazy, let's say this goes viral and I've got 500,000 people that are signing up for this, and they're like, heck yeah, I want to see this. Which I believe can actually happen, by the way. I can see imagine the PTA meeting where you've got the mom who's got the app on here and she's like, hey, check this out. I can look at my person. And then, she's like, oh, well, check out my doctor. Okay. Hey, look, he's good. Oh, check out my doctor. Hey, look, he's good. Hey, check out my doctor. Oh my gosh. Look at this. Can you believe this? Can you believe he's still practicing? And everybody in that room is going to have the app at that point, because it's that, oh crap moment. So yes, if that happens, I want to give you as a patient the ability to pull your medical records in to a system that you control.
It's a great vision.
Nobody's done that well. Everybody has their little subslice, and it's usually a proprietary system. Hey, if you're on our proprietary system, you've got your own little chart. Yeah, I don't want it to be on the system. I don't want it to be controlled by the hospital. I don't want it to be controlled by the physician. I want it to be controlled by the patient. I want patients to get engaged in their healthcare. And so that when they go to a doctor, like let's say I was down in Houston and I was part of the Herman Memorial System, which is a great system. They've got some great physicians, great hospitals. I even helped recruit some of them. But they've got their MyChart deal in there that they're setting up. And then they move to Nebraska and they're seeing a new doctor. Well, I want them to be able to take all that information that they had in Houston from all the different specialists they're seeing and be able to transfer that to their new doctor. And right now, that's not realistic. But that's where I want to go.
It's fantastic and a refreshing vision to hear. You guys are raising on WeFunder right now.
Yeah.
So I guess more in the short term, what's the plans with that raise, and what are the steps
Absolutely.
you guys are taking?
So with the raise, we've raised almost 200,000 at this point. Our meeting yesterday went well, and we got another investor in, so that's fantastic. We've got until I think the 24th of July is when this raise ends. We have used half of that for development, and then we're using the other half of that strictly for marketing. And we've got a fantastic marketing partner. They specialize really in the demographic that we're going after. They've advertised in the health space. They've advertised in the beauty space, which is one of the most competitive out there. And, that's kind of a big deal for them to be able to help us do that and get into that demographic. Because the other reason why that demographic is so important, that 27 to 57, is not only because they're managing healthcare, but they're the most likely to tell their friends.
Didn't think about that. That's very, very easy to see, especially with the PTA example you just said.
Oh yeah. Oh, that is a couple of those. Boom.
Yeah.
And one of those that's actually somebody else's recording on video. I'd pay major money to see that one.
Exactly. Exactly.
Anyways.
So last question we've been asking people. You've kind of answered this multiple different times very well, but I'll give you the floor to answer it. How is GoodDoctorBadDoctor.com going to change the world?
We are going to make healthcare personal, and we're going to give that power to the patients and allow them to make the decisions here. And so that they're making it in collaboration with their physicians. Because what we're hearing, just so you know, this isn't just a patient issue. This is a doctor issue too. One of the things we're hearing from doctors is that some of the online stuff, and I don't want to call anybody out, but when their patients leave their office and then they go look up online to see, oh, let me see my condition. Yeah, my doctor said I should do this, but it looks like I could eat a bunch of mangoes and that's going to do it too. And these doctors are they're so brilliant in their space. Like the things that they're doing, a lot of them do this really, really well. And so when they come up with a custom treatment plan for that patient, following that is your best bet at getting healthy. I want patients to come in and feel confident about those doctors. And I want those doctors to feel confident that the patients are going to listen to them and that healthcare accelerates because of that.
Well, Chad, it has been super enjoyable to talk to you. Love your guys' vision. Love everything about it. Very much enjoyed the conversation. I bet Connor would say the same.
Thank you, Chad. It was awesome. We appreciate it.
Oh, my pleasure.
So thank you for your time very much. And we will see you next time on the Next Big Thing podcast.
Been great. Thank you. Yep. Take care.
Take care.
Legolas.